you for joining us today. Before we get started, I want to share that we are recording today's presentation and it will be uploaded to Oregon Buys. And we're here today to provide an overview of the statewide shelter program, regional coordinator, request for applications. My name is Danielle Bautista-Silton, and I work with Oregon Housing Community Services as an unhoused policy and planning analyst. So I'll be presenting today along with my colleague, Mandy, and I'll pass it over to Mandy to introduce herself.
Hello, my name is Mandy. I work in the grants and procurement section. The current single point of contact in the application or in the RFA is Holly Oglesby, and that's going to be switching to me next week. There will be a notice that comes out through Oregon Buys and in an addendum to the application process. We want to make sure that all of the questions that you may have still funnel to a single point of contact, and I won't be back in the office until mid next week. So continue to funnel your questions to Holly until that notice comes out, and it'll include my contact information as you can see in the slides.
Great. Thank you, Mandy. And then not presenting today, but here to support with our question and will be important contact for you all is a contract administrator, Colt.
Thanks, Danielle. Okay, good morning, everyone. My name is Colt Stray. I use he, him, his pronouns, and I'm the Homeless Services Program Coordinator at OHCS. And yeah, as Danielle mentioned, I'll be serving as the grant administrator for the statewide shelter program. So glad you're all here, and I'll turn it back to Danielle.
All right. And we'd love to know who else is in the room. So if you can please go ahead and introduce yourselves in the chat, put your name and agency and role, that would be great. So our agenda today, we're going to go over the grant purpose and objectives, the grant amount and duration, the RFA eligibility schedule and key dates. We'll go over some eligible activities, reporting requirements, some considerations before applying, how to apply, and then we'll talk about evaluation criteria, and we'll end with space for questions. And if we're not able to get to your questions today, please put it in the chat and we will respond in part of our Q&A process. So the grant goals and objective. Before I get into that, I would like to provide some background, a little background about how we got here. The statewide shelter program builds on Oregon's progress toward creating an effective statewide homeless response system. And in 2024, Governor Kotek's office and Representative Pam Marsh of Southern Jackson County convened the Sustainable Shelter Work Group, really to develop recommendations on implementing a more coherent and a sustainable statewide structure. And in this group developed a set of recommendations, and part of that was really to create this regional coordinator model. And their recommendations are the underpinnings of House Bill 3644, which was passed, that directs OHCS to create this program. And this regional coordinator model is intended to allow communities to identify shelter needs and to determine how funds are spent in their region, and emphasizes collaboration among city, county, tribal governments, culturally responsive organizations, service providers, and individuals with lived experience. So that's sort of how we got here. The primary goal of this RFA, the request for application, is to identify and fund a series of regional coordinators capable of administering shelter services for an assigned region or regions, no smaller than a single county. So these services must be trauma-informed, culturally responsive, and primary low barrier, aiming to reduce unsheltered homelessness and transition Oregonians experiencing homelessness into stable housing. A region here is defined as an Oregon county. So this is based on House Bill 3644, which directs OHCS to divide the state into regions, each no smaller than a county. But an applicant may apply for multiple regions with one application. The regional coordinators will be required to work toward the following goals and outcomes that you can see on the screen. Yes, the slide should be coming up here too, or we're on the current slide. The first one is to ensure that no net loss of agency-funded shelter beds for the region. So OHCS is currently supporting a statewide network of emergency shelters, and we're really looking to see that state-funded shelter capacity across Oregon retains at least the number of beds supported or created during the 2023-2025 biennium. And we'll want to see that applicants are knowledgeable about the region's shelter inventory. Another goal is to ensure at least 70% of program-funded beds and steps use low barrier practices with a balance available for recovery-based shelters and sites. We also are aiming to increase permanent housing placements and reduce returns to unsheltered homelessness. Next slide, please. All right, and just a reminder, folks, if you're joining, if you can please mute yourself. Thank you. Okay, so OHCS anticipates the award of up to 36 grants, which aligns with a number of counties in Oregon. And again, a region is defined as an Oregon county, so an applicant may apply for multiple regions with one application. And regional coordinators are selected for a 5-year period with services beginning July 1 of 2026. The grant awards will be determined by a funding formula, and the funding available for the first year, so July 1, 2026 through June 30th of 2027, for all grants is estimated at $102,500,000. And administrative costs are limited to up to 15% of grants. Next slide, please. Okay, a little bit about eligibility of who can apply. So the organization must be physically located in Oregon, willing to serve at least one region, no smaller than a single county, and one of the following entities. So local government entity, which can include Oregon housing authorities, and nonprofit public benefit corporation. Next slide. Here are some, the schedule for this RFA and some key dates for you to keep in mind. The pre-application conference is today. Glad you're here with us. And then the last day for the application questions or request for clarification is October 31st at 4 p.m. And so that includes any inquiries related to the RFA process, administration, deadline, method of award, or the intent or technical aspects of the RFA. Please route that to the single point of contact. And as Mandy mentioned, for now, that would be Holly, and then that'll be updated to Mandy. So OHCS answers to those questions or requests for clarification is issued approximately November 10th, 2025. And the opening, which is when the application must be received, is November 24th, 2025 at 10 a.m. Any additional rounds of competition is optional at the agency's discretion and to be determined. And the issue of notice of intent to award is approximately January 9th of 2026. And then there is an intent to award protest period. So the protest period would end 7 calendar days after the notice of intent to award. Slide, thank you. Okay, so the next few slides are going to go over some eligible activities with these funds. The first one is a regional assessment and plan. So this is actually a requirement of a regional coordinator to develop a regional assessment and plan. And there's a template provided, if you can see attachment D in Oregon Advise. So the purpose of the regional assessment and plan is to detail the services and outcomes planned for regions supported with the statewide shelter program grant, and they're required to actively seek and incorporate community input into their regional assessment plan. So the first one, it will be due March 2026 for the period of July 1, 2026 through June 30th of 2029. And then in March 2029 for the period of July 1, 2029 through June 30th of 2031. And then subsequent regional assessment plan documents will be due to the agency every 2 years and then will be subject to agency approval. One thing I want to make clear is that applicants, you do not need to submit the regional plan assessment with this RFA, though many of the questions in the application may inform the regional plan assessment, but the completion of that will be required after regional coordinators are selected. All right, we're on the slide on shelter now. So regional coordinators will be required to coordinate shelter services in their region and provide funding to shelter providers in the region. So a regional coordinator may choose to operate shelters, employing a combination of shelter operation and sub-grantee coordination oversight. And some typical activities for shelter would be shelter operations, things like managing, ensuring the safety, cleanliness, compliance with health regulations. All agency funded beds must be primarily available through day and night, 7 days a week, including during all seasons and weather. Other activities under this are participant evaluation, supports, staffing, data collection, facilities, really ensuring that 70% of program funds is provided for shelter with low barrier practices, and then the remaining for recovery based. And then amenities, so basic amenities like food or hygiene, facilities, security, storage, or personal belongings. Next slide, please. Okay, so this one, unlike the first two, this is optional and it's at the regional coordinator's discretion and based on community needs. So the program grant funds can be used for street outreach to connect unsheltered individuals with emergency shelter, housing, or critical services, and to provide urgent non-facility based care. So typical activities might include assessment, consumables like distributing basic need supplies like food, tarps, sleeping bags, etc. Counseling, crisis counseling, collaboration with networking with physical, behavioral, and mental health service providers to establish those connections, and then marketing, advertising, including translation and interpretation to promote awareness of the program. Next slide, please. Okay, the next one is again at the regional coordinator's discretion and based on community needs. So funds can be used for safe temporary emergency placements sites or steps. And steps provide participants with a safe place to stay, either in their vehicle or in a basic freestanding structure provided by the site when available. Some typical activities might include assessment, operations, maintaining staff and facilities, and consumables of purchasing foods, hygiene items, and other basic supplies for step participants. Next slide. Okay. This is housing focus activities is an eligible activity, again, at the regional coordinator's discretion and based on community needs. These are intended to seek to lower barriers for households experiencing homelessness or housing instability. And these activities must actively coordinate services and supports to help households exit homelessness, reduce barriers to rehousing, and ensure housing stability. So housing focused activities include things like financial assistance, helping pay for some move-in cost, and those application fees. Could also include case management, so assessing needs, developing individualized housing service plans, and assisting with housing search and placement and coordinating to access other services. Next slide, please. Okay. Another eligible activity is capacity building. Again, this could be up to 15% of the program grant funds. This can help with things like technical assistance, strategy, and data, like developing or improving data collection methods that inform programmatic improvements. Next slide. Okay, here are some of the reporting requirements of regional coordinators, and you can find this in the sample grant agreement. I won't go into too much detail, but high level, there's a monthly system query report where you would provide monthly disaggregated HMIS data using SAP business objects and report that on a monthly basis. Then there is a biannual housing inventory count or HIC report. And this includes bed, unit inventory and utilization rates. And this would be reports due twice per year. And then the next one is an annual system performance measure report. And then the next one is a sub-grantee report. So this is where we'd be looking at subgrantee information, including their name, project name, their HMIS project type, the number of grant-funded shelter beds, and who they serve, things like that. So that would be due once the subgrantees are selected, and any changes would be updated to OHCS. And then the other one is a victim service provider report. So any grantees or subgrantees that are defined as a HUD victim service provider would be subject to applicable reporting requirements, even if using a comparable database, but must only share aggregate counts without personally identifiable information. And these reports are due 20 days following the end of each month. So that would be a monthly report. And then mentioned earlier, there's the regional assessment and plan. So regional assessment and plan would be due, there's the first one due March 31st, 2026, and then the following March 31st, 2029, and then updated every 2 years. Then there's an annual progress report on describes the progress related to the regional assessment and plan. And then there's a fiscal report due annually. Next slide. Okay, so I can pause for a little bit and hand it over to Mandy.
Thanks, Danielle. All right. So we want to make sure that you receive notices associated with this application, this RFA. So please make sure that you register in Oregon Buys. And there's an area where you'll need to acknowledge the bid so that you receive notifications. There's a contact information here for you if you have any if you need any assistance or have any questions. Also, attachment A outlines insurance requirements. So be sure to work with your insurance agent as needed to ensure you can meet those insurance requirements. There are 3 ways to apply. Please make sure that you just submit your application using one of these methods. Be mindful of the character limit for each response. Any characters exceeding this will be removed prior to evaluation. And as a reminder, all questions need to be submitted to the single point of contact, which is currently Holly. And there will be a notice coming out probably next week that the single point of contact will switch over to me.
All right, I think we're back to me. So we'll go over the evaluation criteria. So there are 100 possible points in the evaluation, and we'll consider the following. So the first is community engagement and coordination. Really here, we're looking at to what extent the applicant has built relationships in the region, and really to authentically involve and include households with lived experience, culturally responsive organization, tribal governments in developing regional assessment and type plans. And then we're also looking at the extent the applicant experience and plan support the applicant's ability to successfully coordinate and communicate effectively with community stakeholders. The next section of and the last one, the community engagement and coordination, there's 24 points possible. The next one is shelter experience and strategies, and there's 24 points possible. So here we're looking at how well the applicant strategy, their proposal really meets the agency's expectation to have no net loss in shelter beds in that region, and also how well the applicant experience and strategy support shelter outcomes. So we're looking at increasing permanent housing placements and reduce returns to unsheltered homelessness, and how ready the applicant is to begin implementing the program by July 1 of 2026. And then also looking at how well the applicant strategies align with low barrier harm reduction and evidence-based practices. The next section is looking at fiscal administration and governance, and there are 16 points possible. So we'll be looking at how well, to what extent the applicant's financial management system and protocols are equipped to provide funding to subgrantees in a consistent, timely manner, and then to what extent the applicant's staffed and resources to ensure fiscal responsibility, internal controls, and accountability sufficient to guarantee appropriate use of grant funds and prevent fraud, waste, and abuse. This section also looks at what extent an applicant can leverage external funding sources to maximize the impact of the program. The next section is on sub-grants, monitoring, and technical assistance, and there are 12 points possible here. And we'll be looking at to what extent an applicant's experience supports their ability to administer program funds to subgrantees and provide technical assistance to help subgrantees improve their systems and outcomes. And then how well an applicant's methodology or approach to subgrantee selection align with our agency's expectation of transparency, use of objective criteria, and clear communication to potential subgrantees. The next section looks at experience with HMIS or alternative system using data, and there's 12 points possible. So this would look at to what extent does applicants' experience with homeless management information system or another robust data system support the applicant's ability to collect and monitor data, particularly on the number of households experiencing homelessness, the type of services they use, and the effectiveness of the homeless services programs. And then to what extent does the applicant plan to meet data quality benchmarks to support the agency's requirement for accurate and timely data reporting. And the last section is 12 points possible, and that's on equity. So there are three things that we're looking for. So to what extent does applicant demonstrate evidence of the commitment to equity, including a plan to approach the program through an equity lens? And then to what extent does the applicant demonstrate an ability to use data to identify disparities in services and outcomes? And then also to what extent does the applicant's experience support capacity to not only identify disparities, but also to design interventions that aim to improve shelter outcomes and provide responsive administration and program delivery to yield improved results. And in attachment C, the application with the questions includes some best practices to consider in the response. Okay, that concludes the presentation part of an overview of the RFA. And I think we can take some questions specific to the RFA. So I'm gonna put myself on mute for just a moment. Okay, so you can raise your hand if you have questions, and we can also start just going through the chat and talking through those.
If it's okay, Danielle, I might address a couple of the quick questions in the chat, and then I think Melissa was first with her hand up, if that sounds okay to you.
Yeah, that did, and I was on like screen 3, so I didn't see the hands raised, but go ahead, Colt.
Okay.
Thank you.
Yeah, no worries. Yeah, some good questions I want to make sure we don't miss. And I did want to just kind of circle back to Mickey's because I don't know if I fully answered it, but Mickey, your follow-up to my answer around recovery base, depending on how you're defining high barrier shelter, so that 70-30 split, the 30% would need to qualify as recovery based, and essentially that those sites still have to meet low barrier criteria except for the sobriety requirements. So they would still have to otherwise have the same policies around not requiring identification, participation in services, kind of the whole rundown that we have under low barrier, but they can impose some type of sobriety requirements as being recovery based. So that is how the bill kind of defines 70% has to be low barrier. If not low barrier, would need to meet the criteria of recovery based. I did want to hit on Brooke's question in here.
Colt.
Yeah, go ahead, Mickey.
Hi.
Sorry.
I just wanted to make sure I got you
Yeah.
clearly. So it's basically 100% low barrier, 30% would need to qualify as recovery based. And the reason I was asking for the recovery based to be clarified in definition is because if you do look at like Google or, you search for it, some state agencies define recovery based as high barrier qualification or criteria or definition. So it would be great if you guys could clarify that and confirm that it's not high barrier, but it's 100% low barrier, but 30% could be recovery based. And recovery based does not mean high barrier. Thank you so much.
Yeah, yeah, we can definitely do that. Thanks, Mickey. And Brooke, you had asked around seasonal sites using SSP funds to become year-round. I would say yes, that is certainly going to be an eligible use of funds, with the caveat, I think, in the process of whoever is selected as regional coordinator submitting their regional plan, having the conversation of supporting shelters that are currently year-round, and making sure if they're dependent on SSP resources, they have what they need to maintain capacity. But as long as that is true, I think the intent is certainly to allow SSP funds to be used to expand seasonal shelter services beyond just, if it's November to March, whatever that season is, to be able to expand to year-round. So I hope that answers that. Yeah, okay, cool. And I'll pause there and I'll let Melissa go. Sorry, thanks for letting me interrupt there.
Yeah, I just had wanted some clarification around your reporting requirements within HMIS and how you want the system performance measures report, system query, housing inventory, and those are all things that fall under the COC and our HMIS lead, who compiles all of that, and we're sending that up to HUD and everywhere else. And how would that work if there was another agency that was doing regional coordination and they don't have, I know we would not want someone else in there doing separate things from us. I don't even think they would be able to with licensing and everything. So
Yeah, thanks, Melissa. I can try. I think our intention is that you would be collaborating with the COC or HMIS lead that's providing this data. But I would like to consult with our HMIS and data teams on the mechanics of that and go into so that's one we'd like to follow up on. If that's okay.
yeah. Yeah, so questions around that, and then how the admin would cut, that's quite a bit of work. And
Yeah, thanks, Melissa, for that question. It's a good one. On my end, it's looking like Chelsea and then Aaron, Commissioner Scar. So go ahead, Chelsea.
Hey, good morning. This is Chelsea from Washington County. I saw there was a 4,000 character limit on responses. Is that character limit per numbered response? Or is it, for example, is it just for answering question 1? Or is it per 1A is 4,000, 1B is 4,000, 1C is 4,000? That makes sense.
Yeah, great question. I'm wondering if, I'm just going to pause on that one, if I can answer in the chat in just a little bit, or if one of my colleagues has that open right now to confirm.
Looking at the application itself, it appears to be each one. Does that answer your question?
Is it each numbered question, or each response of 1A would be 4,000 characters?
A, 1B. 1A would be 4,000, 1B would be 4,000.
Got it. Thank you.
Okay, thanks, Mandy. Okay, Commissioner Scar.
Thank you. Good morning. My question is around who in applying for a region, do you have to have some letters of support from inside the region, or some way to prove that you have in fact communicated with that region prior to applying for them? We've had some issues in the past in other statewide systems where, particularly for small rural counties, we get included in somebody's regional application, but nobody talks to us. So I didn't see in my quick scan of the application anything that required notification or a letter of support, perhaps from local government or agencies that received previous ops funding in that region, local planning groups, something that assures that there's been coordination with the region before it's applied for and potentially awarded to somebody outside the region.
Yeah, thank you. That's a great question. The RFA does not require it in the original in the application, but OHS does reserve the right to request those documents. So letters of support could even be a background check. But for the original application, it does not. And there are questions. The first question is really asking about what is the experience and support within working in the region. So does that answer your question?
It answers my question, but it's not satisfactory. So I would respectfully request that since you are in the open period, that you actually require that up front. And again, I'm speaking from grants that have been awarded, not necessarily through OHCS, but OHA through the CPCCO work has allowed, again, regional partners to apply for our areas without telling us, and they get awarded. So I would request respectfully that you add something to that. And I would suggest that the agencies that previously had OPS funding, that this particular provider is going to be required to maintain those beds might be a great letter of support to request. So I think I really want to lean on that a little bit heavily. Because it is important. I think the purpose in this was that local regions could control their own destiny in a way, because we do know best who our providers are, and we do know best how to do this for ourselves. And to not have that included in the application process feels to me like a really big miss. So I'm going to respectfully ask to lean a little bit heavily into having you add that during this period when you can still add things. So thank you. I appreciate that.
Thank you. Evelyn?
Hi, good morning. My question was regarding regional coordinators. If there is not a regional coordinator selected in our area, how would that then be determined?
Yeah, Evelyn, I think that's a great question. This is one I would like to see if my colleagues from procurement have some, or we can take this back and share more. So the question if I'm getting that right, is if someone is not selected as a regional coordinator for the region, or there's not an application for that region, what is the next step? Right.
Yes.
Okay.
I think that this would be one of those where we should provide a response in writing in the Q&A period.
Okay, that sounds good. Thanks, Evelyn. And thanks, Mandy. I see Rosie next.
Hi there. Thank you so much for this opportunity. But I am having a lot of agencies wonder about how they can achieve those housing focused like goals and getting people into permanent housing when there's such shortages in affordable housing. Is there going to be an allowance for narratives to be submitted when agencies fall short of those goals due to the lack and shortages of affordable housing in regions, specifically rural regions, that we're all struggling with it across Oregon?
Yeah, I think we've recognized that challenge is a challenge that everyone is experiencing right now. And I think, yeah, I think there's an opportunity to explain that in your narrative and share what your strategies are and kind of what the challenges have been. So I think there's definitely an opportunity to add that in there in your response, Rosie. Okay, I don't see any other hands up, but I think there might be questions in the chat that maybe we haven't gotten to, and I want to scan real quick.
Danielle, I'll just throw out there a couple kind of similar questions throughout around some of the HMIS wording in the as far as the expectations for reporting. So I think just so everyone knows, we're going to package those up when we have a chance to consult with our HMIS administrator and make sure we get all of those answered. I just didn't want anyone to think we'd skipped over those, but that's all I wanted to throw out there, Danielle.
Great, thank you. Okay. Um, can I ask my colleagues to monitor the chat and then raise those to me if I can't get to them? But I'm going to keep going on the hands raised. Um, I see M Steele. I think it's Monica, but I want to make sure I see your
Yes.
hand raised.
Thank you. And I want to say this with all due respect, but it was mentioned earlier, a single point of contact. And so I'm just wondering, because there's times that OHCS isn't always very responsive. And so if there's just a single point of contact, who's going to be making sure that the questions are answered in a timely manner?
It will be my responsibility to work with Danielle and all of the OHCS team to make sure we get your questions answered in a timely manner.
Andy, can I just add a little bit to that? Monica, in the schedule, in the request for applications, that's considered as well. So the goal is to have everybody's questions answered, everything kind of finalized, so you know that there's not going to be more changes by November 10th. It's an approximate date, but that is our goal, and we're pretty good at meeting that one.
Thank you.
Okay, let's see, we'll go with, I think it's Howard, then Commissioner Scar, then Evelyn and Sarah.
Good morning, everyone. The question that I have is, I'm curious regarding the requirement about no net loss in shelter beds. If there's a situation within a region in which a entity that previously was receiving state funds has decided that it's no longer going to receive those funds before this application is submitted, I'm curious about where the excuse me, the line is going to be in terms of the starting point for the identification of the number of shelter beds. Where if it's known ahead of time that there's an entity, say, that is operating, I'm just going to throw out a number, 25 beds, but it's already known that they're not going to participate any longer in the statewide shelter program. Is there still going to be a requirement that 25 beds are created essentially to take the place of the 25 that are being dropped? Or is it going to be understood that at this point right now, the starting point is that those 25 beds are not part of the measuring stick?
Yeah, I think this is one I would like to debrief a bit more with our team to answer, because part of the question that we have too is like, is your familiarity with the shelter inventory in the program, knowing what's open, what's closing, knowing your strategy to keep as many of those open as possible. And then there's the grant agreement period where there would be some negotiation on which actual shelter beds are being funded, and talking and working with your grant administrator on that. So, but I'd like to again take this back to our team to, to your point of the question of the point in time of where that cutoff is and what period we're looking at. Because I think it's a great question, Howard. I appreciate it. Unless there's any of my colleagues that have anything to answer now, otherwise we can take this back to our team.
The only thing I would add, Danielle, and to kind of answer another question that's in the chat about can these funds be used to support new shelter beds? I would just kind of provide a similar answer, Howard, and whoever had asked that, just in terms of it is going to be a process throughout that planning phase of determining, for your example, Howard, if there was an entity that threw their hat in the ring to open up a certain amount of beds or 25 beds, and in those situations, bringing on new beds would certainly be eligible here. So we recognize there might be some element of that as well throughout the planning process. So it is going to be, I think, a lot of discussion once that information is put into your plan, and provide in that context is, I think, important to provide. I think that is recognized here. But yeah, Danielle, I think we can talk more and maybe provide more response there. Just wanted to add that.
Thank
Yeah, I
you.
appreciate it.
Great. Commissioner Scar?
Thank you. So this question is, it kind of is one that you may need to take back to your team, Danielle, because it's kind of similar to the what if nobody applies? What if the entity that applies you feel like may not be a super strong applicant, but they're the only applicant? So I think, there's curiosity, and some of that comes from would for single counties, would it be worth having to apply for our county in case you decide that we're not strong enough? Kind of how does that play out in the prioritization? So if someone applied and they were the only one and you had questions, what would the response be from OHCS?
Yeah, that's a great question. And I think you're right. That's one I would like to bring back and we can provide in writing to you. All right, Sarah, and then I think it's Rebecca.
Thank you, Sarah Kellums, Mid-Columbia Community Action Council. I'm in the Dalles. I have a question around the community engagement process. I absolutely value community engagement. We have really strong existing partnerships in our region. I'm concerned about the timeline between the announcement of regional coordinators and just having less than a 2-month timeline to submit a community engagement plan. And I understand that it can be built on past efforts. However, I'm curious to hear from OHCS or other regional shelter providers ideas on how to create a true engagement plan that represents authentic engagement around this opportunity within a very short time frame.
Yeah, thank you, Sarah. We appreciate that question and hear that. And one of our intentions of trying to have the regional plan template part of this RFA is so that you can see now what kind of questions are coming up and start identifying what your strategies would be in that timeline. And also recognizing the constraints of when we need these regional coordinators to be operational and recognizing all the other subcontractors. So I just want to acknowledge, I hear you. It is a crunch timeline. And I would also love and encourage folks if you had other strategies that you want to share that have worked for you on your communities. And I would love the kind of the collaboration on that too. Thank you, Sarah, for that. Anyone else have any to add to that response from my team? Okay. And I think it's Rebecca next.
Thank you. I just wanted to check in about the sort of to vibe off of Howard, I believe's question about shelter bed numbers. It would be really helpful now and throughout the next couple of months as communities who are already attempting to implement the phase 1 of the statewide shelter program to understand the data that OHCS is using to inform the funding allocations and the specific shelter bed numbers for each community. I think that there needs to be more conversation back and forth with local communities, even through the, say, regional coordinator position process, just to make sure we're all on the same page. This could be, a direct discussion and sit down and then be able to go back and forth and check the data that is actually ultimately using for communities. Would be very helpful.
Thank you for that, Rebecca. Okay. Okay, I think I see Evelyn, Isabel, and then Claudia.
I had a quick question with regards to who sits on the board to review the application, because that's really critical. We are a service provider. We do have 2 shelters. I actually sit on the RAC advisory committee. In addition to that, I believe that all of us in the room probably have the same consensus with regards to having a regional coordinator to make sure that the application is in fairness, to make sure there's a relationship with the chosen regional coordinator. So the question is, who sits on the advisory committee for the application review process?
Yeah, Evelyn, that's a really good question. As far as the names of folks, I don't know if we can provide that. And truthfully, these are still being under development and identifying those, but we are trying to make sure that the evaluation committee brings expertise around knowledge of the shelter system and trying to address some of those concerns that you have. But um, any, I'm sorry to pivot to my colleagues, but from the procurement side, is there anything that you want to add to that?
As for folks on the evaluation committee,
Yes, yeah.
we definitely want to make sure that the folks that are selected for the evaluation committee are able to commit to the timeframes that we're outlining for this. That's really important so that we have continuity of review and there aren't any delays. So that will be one thing that the program will definitely want to consider as they're selecting evaluation committee members.
Thank you. Okay, we have Claudia and then Chelsea.
Hi everyone, Claudia from Capco here. I just have a question regarding the involvement of the local planning groups in this RFA and this regional coordinating application, because we have a pretty active local planning group and we're meeting next week, and I know that they want to know what their role is or what support they need to provide. And I don't really, just kind of like Commissioner Scar was saying, there's not a whole lot when I briefly perused it either. So kind of how do we roll this out to those groups that are pretty invested in this type of work? Or what can we tell them that they need to do or not do, you know?
Yeah, I think as far as the RFA goes, like you would want to talk about who your planning partners are in that. And I think you would include those groups and talk about that. And then definitely once regional coordinator is selected, any planning partners will need to be part of developing your regional plan assessment and plan. So I think that's sort of the point where they're going to be really involved. But initially, it's talking about what those partnerships that the agency that's applying has with the community. Thank you for that
Thank
question,
you.
Claudia. Yeah. Chelsea?
Hi, yes. I apologize. I don't remember who asked, but on the question of the regional plan due in March, I wanted to see if it would be appropriate to use previous community engagements on similar topics or previous like equity analysis that's already been done in our region to inform that, or if it needs to be like a new engagement that directly answers each question.
Yeah, thanks, Chelsea. You'll see in the regional plan template, our intention is that you can build on existing engagement that has happened. So there are some, and some questions in there where we would like you to answer. So if there's pieces to previous engagement that don't answer that, that's where we might ask that you build onto that. But otherwise, please do build on what's already happening in your community. Okay, from my view, I don't see any other hands up. Just checking, does anyone else see hands up? Okay, let's go back to the chat.
Danielle, would it be helpful to you to repost the outstanding questions in the bottom of the chat?
That would be great. Thank you.
Let me do that. Here's the first one.
Okay, the first one was about, oh, saw a couple more just show up right after that one. Okay, during previous EO awards, the HIC and monthly system query reports was pulled directly from HMIS by OHCS and balance of state COC. Will the SSP move the responsibility to the regional coordinator to pull data that OHS has access to? I think this might have been a question that also was a raised hand that we're going to get back to you on to make sure we understand the, so we'll get back that on in writing. Thank you. Okay. The next question regarding 2.3.3.2, it's a mouthful, shelter. The capacity bullet point, it says ensuring a minimum number of shelter beds are available. How is the minimum determined? Does this number come out from the regional plan? Yeah, and I think there's lots of questions about the minimum number of beds and the no net loss in beds. So we'll come back for more guidance on that too. Oh, and I see a hand up. Go ahead, Claudia.
My hand is actually just about Oregon buys as a whole. Now there's some of us in organizations that use this more than other organizations. And then there's some of us that only use it very minimally. And finding the RFA in Oregon buys, if you're not familiar with where you can search for it, is really difficult. So I don't know if there's like a little quick tutorial that OHCS can provide and send out so folks can actually find the material, just because I know I've helped a couple people, but it's not as intuitive as you would think. So it would be great so that other folks that are looking to apply know how to find the information or are looking for this recording or the slides or anything like that, because it's not intuitive. So just for our fellow people that might be looking to do this too.
Yeah, I appreciate that comment and feedback, Claudia. As for a tutorial or instructions, I think the instructions are there, but is there any other type of support around that? That we can offer? Okay.
Hey, Danielle, I was just going to go back to the question about the HIC and the balance of state COC. So I did want to let balance of state folks know that the capacity building support with I think it's called the OC3 now, so the balance of state COC is continuing with OHCS in 25, 27. And so we'll get back to you about exactly what that looks like, but David Mulig will still be offering support to folks in the balance of state through the COC. So I just wanted to clarify that.
Thanks, Liz. Okay, Rebecca?
Thank you. Yeah, this kind of just a spin off my original question. I understand that this is still in development and you'll get back to us, but one specific lens that I would like this specific question to be under is around the recent shelter survey that was sent out to communities. It would appear that that survey was just to essentially create sort of an average cost per bed for statewide. I would like to understand throughout the process if that data at all will be used to make decisions about specific communities rather than just developing some averages for the whole state. We understand that there were several surveys over the course of the last 4 years, and those surveys may have been conducted to achieve one effort and then were used to achieve newer efforts and may not have been actually update and accurate for the initiative that data was being used. So it would be really helpful if there was transparency around how that data is being used in any decision-making processes throughout this regional coordinator effort.
Do you want me to take this one, Danielle?
Sure, go for it, Liz.
Okay, thanks, Rebecca. Yes, there was recently a shelter shelter survey sent out to folks, and I appreciate everyone's efforts on that survey. I know it was a complex effort. So this survey did come from a budget note in House Bill 5011, and the intent behind this survey was to understand cost containment strategies around both shelter and also eviction prevention. And so that is that information that we gathered, and you're right, Rebecca, how you framed it, will be going to a report to the legislature in February. At this moment, we know that there is going to be a request from the legislature or a response to that report and the recommendations that we're making, but we can't fully predict exactly what that will look like yet. But we understand the importance of the information you shared and wanting to know how it is going to impact the work that you're doing. So I know the answer that we can't fully predict what that looks like right now isn't the best answer. But if there is opportunity to share more clarity, that's something that we can perhaps do down the road. But ultimately, what that information is for a report for the legislature in February.
Thank you. Yes, that's very helpful. It just is, I understand that sometimes, like even in our community, we'll collect data for one initiative and they're like, hey, well, we still got this. Do we really have to go back out and check to see that this will work under this?
Yeah.
So if there is a point where, say, another program at OHCS says, hey, look at this great data that we could pull, we will use this to establish the requirements for this community directly versus having, hey, calling that community before that decision is made.
Yeah. Totally. And thank you for your question, Rebecca. And thank you for working on that survey.
Okay, thank you. Holly, thanks for putting the questions in the chat again so we can see which ones are being answered. One was, what level of TA will OHCS be providing throughout the process to enable regional coordinators to be successful? I think so. As far as the RFA process, while this application is open, you can reach out to the single point of contact for questions, but we won't have technical assistance during that open period. Once regional coordinators are selected, so we're looking internally to see what options around TA we might have available, but that's still under development right now. Let's see. If an organization is selected as regional coordinator for a region, county beside the one they operate in, will there be stipulations that the shelter in the other counties receive a fair share of the funding? I'm not quite sure if I understand that. Does with the person who
Yes, I'll clarify that.
Thanks.
So if an organization that operates their own shelters in another county applies for a region that includes counties outside of where they normally own shelter, so they get a group of counties together, will there be any assurances that the funding they receive as the coordinator for that overall region doesn't just, be over allocated to a county or an area that they may operate in? In other words, like we're a current grantee and you tell us who to fund and you give us a big lump sum, but you don't tell us how much to give each person or each shelter. That will, I'm assuming, still be up to the regional coordinator. So I think there's fear going, and this is kind of in the same vein as what Aaron was talking about. There's fear that if somebody's chosen who really doesn't normally work in your county, but they work in a county where they own the shelters, that there'll be a tendency for them to, we just want fairness in the allocations, I guess is what I'm saying.
Yeah, thank you for that comment, Dina. A regional coordinator, if they apply for that for each region, they'd be responsible for trying to demonstrate equity within each of those regions. But I think also just add that they'll more information on the actual allocation will be forthcoming. So I'd like to follow that up piece in writing later. Okay, we're at time, but I do see two hands up, and I would like to continue to answer those two if we can, and then we'll kind of end there. But feel free to drop off because we did commit this until 10. So, but Brian and Brooke, I would like to be able to answer your questions.
Thanks. First, kind of leading with Dina's question as well. I see we can have up to 36 regions, but if a regional coordinator applies for 3 regions, do those 3 regions become one region and therefore one pot of money?
Yeah, that's a great. At this point in time, a region is a county, so
Okay.
it would be based on the county.
Okay, and sorry, my second question was, can you just review what the next 5 years looks like as far as payment systems? So in other words, are you reimbursing expenses monthly? Are you prepaying to the regional coordinator? Does the regional have to carry any of the debt for 2 weeks while they've paid their grantees, but they're waiting for you guys to reimburse? What does that look like from a payment standpoint?
Yeah, I can answer that one,
Great,
Danielle. Good question, Brian. Yeah, so it is going to continue to be reimbursement based, similar to how the ops agreements were, but there is also allowability for regional coordinators to submit requests for advances depending on circumstances. So there's kind of consistent language in our grants around the ability to request for advances even with a reimbursement grant. So that'll stay pretty similar to previous grants, but happy to share more specific the language that you'll see if it's helpful. But I hope that answers the question.
Yeah, just the expectation. Would you expect a regional coordinator in general to carry debt while we wait for the state to reimburse us after we've reimbursed others? Is that the expectation, or is it reasonable for the regional coordinator to ask for the advance of what they would normally run into so that they're not carrying that cash debt for a 2-week period or however long it takes for the state to reimburse? So.
Sure. Yeah, I would say that is a scenario that we would often see as the rationale or justification for requesting in advance. So
Okay.
yeah, I think depending on the position a grantee's in financially, that is often what we'll take into account. So that's a good example, Brian, of a reason we would look into providing in advance of funds. Even things like payroll obligations, that type of thing. So yeah.
Okay, thank you.
Sure.
Okay, and Brooke will end with your question.
Actually, it's more of a statement than a question. Sorry for being off camera. I am fighting the flu. Because this crowd had a lot of balance of state recipients in it, I just wanted to clarify when we're talking about the data reporting requirements. I guess it's more of a reminder that this is going to look a little different than what we've been doing with reporting in the past, but also similar. And we all know that David and Shri are amazing with data, but just a reminder that they are just 2 people and a lot of, I just want regions to remember that there is still reporting requirements. This isn't being said in this meeting that, oh, the balance of state is going to handle all data reporting. Because I don't want there to be a miscommunication later that it was said in this meeting that the balance of state data support was going to be handling that. There are still going to be regional requirements for each regional coordinator for data, working with David and Shri and the balance of state team for those data requirements. And everyone that works with David knows how amazing he is, and we will support in the absolute best way that we can. I just want to remind everyone that he is a single human being. And so, and 26 counties is a lot. So just keep that in mind, please, when we're talking about data requirements with the balance of state.
Thanks, Brooke. I also, yeah, my mentioning of the support from with OC3 and David, thank you for clarifying that, because we are still going to get back to that question, and that you're right, David is just one person, but we all appreciate him. So thank you for that clarification.
Thank you, Liz.
Okay, I think we can end. I just want to say appreciate all of you for being here, for your excellent questions, and I'm excited about this opportunity and to in this process. So if any other questions come up, feel free to reach out to us. We have all the questions that are in the chat, so things that we didn't get to, we will make sure to respond to those too. Okay, we can end now. So thanks everyone. Have a great day. Take care of yourselves. Bye now.